Thank you. Good morning, everyone. Thank you so much to the committee and to all the fund contributors for this opportunity. My name is Darlene Lee. I'm a naturopathic doctor practicing at the Susan Samueli Integrative Health Institute. So myself and my colleague, Dr. Arvind Janab, working with our executive director, Dr. Shaista Malik, obtained this funding to complete a project focusing on managing stress among COVID-19 frontline workers. So you can see the title here, quite a mouthful. But so it's clear that the pandemic is having and will continue to have a large impact on the mental, physical, and emotional health of frontline healthcare workers. Even before the pandemic began, the burnout rate of physicians and nurses was estimated to be approximately 50%. And this is expected, of course, to increase. Early studies done at the beginning of the pandemic in Wuhan, China, show that approximately 72% of the healthcare workers caring for COVID-19 patients exhibited at least one symptom of PTSD. And that same study concluded that these healthcare workers are at high risk of developing unfavorable mental health outcomes. So this figure on the right shows the typical emotional trajectory after a disaster event. So this is actually the effect on the general population, but we can apply this to healthcare workers. And you'll see that around 6 to 9 months, so where my cursor is, after the initial event, the greatest impacts are seen. But of course, this depends on the trajectory of the pandemic, successive waves, et cetera. But knowing the potential effect on frontline healthcare workers prompted us to consider how we could help develop tools for healthcare workers to use that are effective, that are easy to learn, that can be taught very quickly, and that can be integrated very quickly as a way to mitigate stress. And that could also be offered safely given the considerations of this particular pandemic. At the Institute, one of the modalities that I employ within the integrative medicine context is biofeedback. And I work with people daily, teaching them tools to control their stress response as a means to control either stress-related symptoms or conditions. So often these sessions are over the course of many weeks, but we wondered if we could take these tools and teach them quickly to healthcare workers in the form of brief telemedicine sessions over a shorter duration of time as a way of very quickly arming them with self-regulation and stress management tools to offset the effects of this pandemic. So thus, we designed a study. So we're asking if a series of 5 brief telemedicine sessions teaching heart rate variability biofeedback along with related self-regulation techniques to a group of frontline workers is as effective as and non-inferior to the same intervention delivered in person as determined by stress and heart rate variability measures. I'll talk a little bit more in detail about the intervention in a few slides, but I wanted to give a brief explanation of what biofeedback is for those who are not familiar. Biofeedback is a modality of mind-body medicine. It uses non-invasive instrumentation to measure and monitor physiological markers such as heart rate variability, sweat on the hands, surface temperature, muscle contraction, brain waves, breathing characteristics, things like this. So patients are viewing these measures in real time, and during that time, they're taught tools to control those measures. So the aim is to teach a patient or a client to manipulate those measures in order to improve health or performance. And it can be thought of as a way to train the autonomic nervous system and to have more control over the stress response. So there's a large body of evidence for the use of biofeedback for a variety of conditions, and particularly those that have a stress component involved, such as hypertension, anxiety, headaches, GI disorders such as IBS, etc. So this study in particular uses heart rate variability biofeedback. So heart rate variability is this measure of the change in the heart rate over time. It can be expressed both at, in time and frequency measures, but all of those are derived from this interbeat interval, so this R to R interval. HRV is known as an indicator of cardiac vagal tone and autonomic balance. So it's measured either by EKG or by using a sensor called a photoplethysmograph, which is basically the same technology that's used in pulse oximetry devices. Both clinical and consumer Hrv biofeedback devices use these PPG sensors, and they're usually either clipped on the ear or on a finger. And in Hrv biofeedback, patients are taught very simple rhythmic breathing techniques and other self-regulation tools while they watch their real-time heart rate data. So the aim is to maximize their heart rate variability and to alter their heart rate rhythm curves to more resemble a sine wave, maximizing the amplitude of this wave. So the intervention that we designed is a series of 5 brief telemedicine visits during which we'll be teaching heart rate variability biofeedback over the course of 10 days. So in those off days where they're not having a brief session, they will be viewing brief videos which reinforce this teaching. And they will also be asked to implement daily home practices, and they will then share the screenshots of their practice summaries with us. Each session will be approximately 30 minutes long. It'll be delivered virtually via Zoom by trained biofeedback clinicians, which does allow for physical distancing. And we decided to narrow our study population to medical and nursing trainees, residents, and fellows who are working on the front lines because of this population's particular vulnerability to stress and anxiety, which is documented in the literature. So our comparison will be a group that receives an identical intervention, and this will be in person at the medical center. We'll be using this commercially available device, which is pictured here on the right, which is a Hrv biofeedback device called Inner Balance. It's used with a smartphone app, and it connects wirelessly via Bluetooth. It is made by the company HeartMath. So there are many different studies showing efficacy of biofeedback, and in particular, there are many studies which use heart rate variability biofeedback combined with self-practice, so similar to what we're doing in this study. And they're using that with healthcare workers. So they've been able to show decreased measures of physical and emotional stress among healthcare workers. And there's also evidence that remote Hrv biofeedback, so completely self-guided, no guidance from any type of biofeedback practitioner, can also be effective. However, there are no studies looking at remote guided Hrv biofeedback interventions, so using this telemedicine model. But we've been interested in it, and since April, after the start of the pandemic, we've been piloting this idea of remote biofeedback. And through the Susan Samueli Integrative Health Institute Employee Wellbeing Initiative, we've been offering remote sessions that are approximately similar in length, so 30 minutes, teaching very similar tools, albeit without the instrumentation, so just taking the slow rhythmic breathing tools, etc. And so far, we've had great success with it. We've had over 150 participants in this specific biofeedback program, and the feedback for the sessions has been overwhelmingly positive. So we'll be using a few different outcome measures to, the first is the Depression Anxiety Stress Scale. This is the 42-item validated tool, and it measures negative emotion states. So we chose this tool because it not only examines depression, anxiety, and stress, but it also looks at autonomic arousal. So it's known to be sensitive to kind of chronic non-specific arousal. So we will have participants complete this scale at baseline, after the 10-day intervention, and then a month later to see if there's a sustained effect to the intervention. To measure the session's immediate effect, we're going to use the state trait anxiety inventory before and after each of these 5 individual sessions. And in addition to these psychometric measures, we will be measuring HRV scores at baseline from their independent home practice they'll be completing on their own, and at the conclusion of the intervention. So this is a simple HRV score, which is based on the algorithm of this particular device that we're using. So we'll be examining the change in these measures and comparing them with in-person biofeedback to assess efficacy and also non-inferiority to the in-person intervention. So currently we are in IRB review, hoping to get an expedited review and hoping to begin recruiting for this study in late August. And I'm happy to take questions if there's any time for it.
Let's say there's time for one question.
Can I ask a quick question?
Yes.
Darlene, thank you. One of the things we've noticed is that when there are outbreaks among healthcare workers, it's not because they didn't pay attention to PPE, it's when they took it off and interacted with their fellow coworkers. Do you think there's a correlation between the stages that you developed and you know, the willingness to really take care of yourself?
Yes, I mean, I guess we're thinking about sort of the effect of stress on behaviors, including those that can protect yourself and others. So that's an interesting question. I mean, this won't specifically look at that in this study, but in terms of the effect of stress on self-care behaviors, which this would sort of fall into, yes, I do believe there could be some correlation there. So that's an interesting thing to explore.
And also the break room outbreaks, I guess, could feed into that same thing that Dana's asking
and also,
about.
I guess also just sort of fatigue with using the safety protocols, and you know, all of those things will kind of interrelate with stress levels, and hopefully the ability to reduce that level of stress can help shore up these other practices. So
Maybe you should think about that, Darlene. That's a really important issue.
Yeah.
Thank you very much. That was really interesting and again, really important.